Jeannie with SBR Therapy and Wellness in Cedarburg, Wisconsin. Today I'm doing video 2 of my postpartum series on YouTube. So today I want to talk about the Breathing Kegel. Most people know what Kegel means. It's a pelvic floor contractions. It was developed by Dr. Kegel in the 1950s to help. It's a series of contractions of the pelvic floor muscles, a group of exercise contracting and relaxing the pelvic floor muscles to improve incontinence. There's numerous studies out there showing that pelvic floor contractions does improve incontinence. And clinically, I can tell you that's true. My patients have had numerous results with improved incontinence with pelvic floor contractions. It's not the only thing that you do for pelvic floor problems, but it is one, and it's one we'll talk about today. And I specifically want to talk about an exercise, pelvic floor contraction exercise called, which I like to call it, the Breathing Kegel. So I want to use the Kegel muscle, the pelvic floor muscles, to breathe. Breathing involves lots of muscles, and specifically the deep core muscles, and the pelvic floor is one of them. So with breathing, we're going to talk about how to activate the pelvic floor muscle by using the diaphragm. And 2, we're going to use breathing as a way to bulk and strengthen the pelvic floor muscles. And 3, we're going to improve the function of breathing and the function of the pelvic floor by doing these exercises. So this exercise is called the Breathing Kegel. And so we're going to start it by taking a deep breath in. So when you inhale, the diaphragm drops and the pelvic floor muscles should also drop. And you might feel this easier in standing, as if you're on a hard surface, it might not drop as easily. But you should still feel it. So the pelvic floor is lengthening, just like a bicep shortens when you curl, and it lengthens this way. So every muscle has a lengthening and shortening property. So when you inhale, the diaphragm is going down, it's contracting actually, and the upper abdominal muscles are coming out on all sides. You'll see the ribs flare out, and it'll come out on the upper abdominals, and you'll feel it on the ribs behind when you inhale. On the pelvic floor, you should feel the movement of the pelvic floor going down, and it's going from pubic bone to tailbone. This is the direction of the fibers in general. There's a group of muscles down there, but that's a general movement. You can think pubic bone to tailbone. So the tailbone will actually flare out. So your coccyx, it should come out and exhale on exhale. So when you exhale, the coccyx comes out like a dog wagging its tail, comes up, and then on exhale, it's contracting. The pelvic floor is contracting, it's shortening. So tailbone to pubic bone. So I call this the Breathing Kegel. So you take a deep breath in. You can actually use that diaphragm to activate your pelvic floor if it's weak. So if you have trouble contracting it, this is one way to get it firing again, kind of reflexively. So you breathe in, pelvic floor lengthens, air fills. It's improving the vacuum effect of air. High pressure chasing low pressure. The air from the atmosphere is coming into your lungs. And then you exhale, pelvic floor contracts, tailbone to pubic bone. Contracted to its end point. Really shorten the pelvic floor muscles. Really tuck that tailbone under. Just like anything, if you're doing bicep curls, you can really curl it, or you can just let it fling back and forth. I want you to really tighten it. So you're going to go inhale. You're going to lengthen. You come to full length just like you would with a bicep curl. You're not going to stop halfway and just go here. You go all the way. Tailbone comes out. Pelvic floor lengthens. It's working eccentrically. You're not just dropping the weight. It actually is contracting eccentrically. It's a lengthening. Okay, and then on the exhale, tailbone to pubic bone, really push all that air out, like all of it. Okay, so those are the exercises. Well, that is one exercise, so you could do that 6 times 10 a day, and it seems like a lot, but it's called mass practice, especially if it's not working. And that's another thing you can assess. Is your pelvic floor working? It should be working with your breath. So on inhale, It should lengthen on exhale. It should shorten. This is something I do assess when doing pelvic floor exams, internally, vaginally, or rectally, depending on the needs of the patient, and obviously if it's female or male. But it should lengthen on inhale and shorten on exhale. So I hope you learned a little bit about your pelvic floor today, and you can check us out for the next video, video 3.